Are you considering using gabapentin to help with your anxiety symptoms, whether it's generalized anxiety, performance anxiety, or social anxiety? In this video, we're going to investigate the anticonvulsant medication gabapentin, understand how and why it's used off-script for anxiety purposes, and see if gabapentin really is a good option for anxiety purposes. Keep watching to learn everything you need to know about gabapentin for anxiety. Before we get into the details about gabapentin, let me tell you about our performance anxiety supplement called PerformZen. PerformZen is an all-natural supplement specifically designed to help performers and anyone who regularly faces high anxiety situations. It helps performers stay calm under pressure, while even giving you a slight mental edge. Many of our customers have used gabapentin in the past and found PerformZen to be an extremely effective natural replacement. So if you're interested in finding out more, learn all about PerformZen at PerformZen.com. What is gabapentin? Gabapentin is actually the generic name for Neurontin, a prescription drug that belongs to a class of medications called anti-epileptics. Originally approved by the FDA as an anti-seizure medication, it was designed to be used in combination with other seizure control medications to manage and prevent seizures associated with epilepsy. Even though gabapentin was not made for anxiety purposes, it is often used off-label or off-script as a treatment for anxiety issues. It is actually widely claimed that off-label use of gabapentin is far more common than seizure prevention, particularly in psychiatry. Several emerging studies have shown the effectiveness of gabapentin for fighting anxiety. In one such study, researchers tested a daily gabapentin dose of both 300 milligrams daily and 900 milligrams daily in women who had been treated for breast cancer and who had anxiety about it. Both doses of gabapentin improved anxiety symptoms after 4 weeks, compared to placebo, which was a pill with no medication in it. More recently, several U.S. states have classified gabapentin as a controlled substance due to the potential for abuse if not used properly, and the mortal risk from overdose if abused. We now know that the abuse and addiction risks are due to the euphoriant effect of gabapentin. So usage of the drug must be prescribed by a medical professional and monitored closely by all involved. Despite these risks, gabapentin has still proven helpful for anxiety and insomnia issues. It just has to be used carefully and be issued by licensed professionals. How does gabapentin work for anxiety? Gabapentin is a synthetic version of the neurotransmitter GABA. Neurotransmitters are chemicals that carry signals between nerve cells, and gabapentin mimics the role that GABA neurotransmitters play in the body. GABA, or gamma-aminobutyric acid, is actually a naturally occurring amino acid that acts as a neurotransmitter. GABA is widely recognized as having a calming effect on the brain, and GABA deficiency is believed to play a large part in anxiety disorders. The GABA neurotransmitter can help slow down neurons firing in the brain, and gabapentin works in a similar way, helping to quiet the brain and decrease pain transmission in nerves. For seizures, gabapentin works by decreasing abnormal excitement in the brain. It can also change the way that the body processes, or senses, pain, which can help alleviate pain caused by shingles and similar conditions. And while the exact mechanism of action for gabapentin is not yet fully understood, scientists have established that gabapentin increases GABA in the brain through the process of increasing activity of the enzyme glutamate decarboxylase, or GAD. So when gabapentin binds to the calcium ion channels in the spine and brain, it is actually able to reduce the abnormal brain activity that causes seizures, tremors, and pain. This makes it a very effective anti-epileptic drug. And while gabapentin has proven effective at emulating how GABA works in the body, slowing down neurons firing in the brain and pain transmission in the nerves, by itself, gabapentin isn't the best anxiety treatment out there. Gabapentin is mostly prescribed to ease anxiety symptoms for someone who also has depression or bipolar disorder, as anxiety is commonly comorbid with depression and bipolar. While studies do show that gabapentin may be better than a placebo to treat generalized anxiety disorder, it's just not significantly better. There are a number of studies that have shown that gabapentin may be slightly more promising for social anxiety disorder, but they are not conclusive. So is gabapentin the best solution for anxiety symptoms? Gabapentin is a widely prescribed medication in the US, and it is used to treat several different conditions effectively, including neuropathy, seizures, and restless leg syndrome. Used off-label or off-script, gabapentin is clearly effective at helping treat symptoms of anxiety. There's no question that gabapentin is a potent and effective drug, especially when combined with certain other drugs, as advised by a licensed medical professional. For the express purposes of reducing anxiety symptoms, however, gabapentin can provide a much-needed relief from physical anxiety symptoms so you can get through what you need to do. But gabapentin, or any other drug, will never be the solution you're really looking for long-term, which is to not be fearful about anxiety in the first place. To overcome generalized or performance anxiety in the long term, consider natural alternatives for anxiety like what we cover in some of our other videos, or try a natural anxiety solution like PerformZen, link in the description. In the meantime, if you are considering gabapentin as a quick fix for your anxiety symptoms, be sure to talk with a doctor first to make sure it's the right solution for you. And until next time, break a leg.